Now, one of the most reliable doctors in this family, the amazing Dr. Kuti is here with us. Now, he's a GP, and well, when it comes to the importance of putting our health first, it can't be overemphasized. We're going to be kick-starting this month's health segment with this issue of arthritis. Now, for those that don't understand what it is, what it means, what can you tell us about it?
Okay, from the word arthritis, basically is an infection of the joints.
Okay.
So arthritis means anything that affects the joint, any joint of the body.
Okay.
And we have various types. So we have the rheumatoid arthritis, osteoarthritis, but I want us to stick to the most common one, which is osteoarthritis.
Okay.
So osteoarthritis means the bones and the joints. There's a wear and tear kind of reaction within the bone and the joints, and it usually occur as a result of overuse of that joint, or sometimes as a result of pressure on that joint, probably due to the weight, and also some family history, genetic history has been associated with it. So if you have it in the family line, there's possibility that of the person having osteoarthritis.
Okay, so when I hear joints, you know, I hear bones, and I think of my car, you know, ball joints and all those things, and they talk about making sure they're all well lubricated and they're all, you know, they're well maintained and serviced.
Yeah.
So does it apply in this case as well? You know, do we need to service our joints?
Well, it applies in this case a bit because, like you said, ball and socket joints. We also have ball and socket joints in the human body.
Yeah.
But the most common one is usually called the synovial joint, and they're the knee joint, the hip joint. So when you get to the joint, the two bones don't touch each other. You have a cartilage that protects the two bones from touching each other. So that cartilage, after so much use, there's a wear and tear. The cartilage wears off, and the two bones start touching each other. So it's when the two bones start touching each other, you start feeling the pain of osteoarthritis. So that's why most times you need the exercise, you need something like lubrication, but we don't apply oil. But with physiotherapy and some regular exercise, yes, you can keep the bone healthy and the cartilage. Okay,
so for those that are living with it, is there something they did wrong that led to it happening in the first place?
Well, like I said, there are some things that interplay to cause osteoarthritis. Basically, we call them risk factors. So for people that are obese, yes, is a common cause of osteoarthritis because you're applying pressure on that nail joint. People that overuse the joint, you're kneeling, you're doing activities that involve the joint a lot. Some people just have the genetic, the genes to cause osteoarthritis. And some people, old age, as you're getting old, our organs in the body, they start wearing off. So those are risk factors that can predispose you to having osteoarthritis. So the most important thing now is when you have it, how do you manage it? How do you go about it? So the first thing is you have to be educated about it, know what it is. It's not a life-threatening or it's not a death sentence. It can be managed. So part of the things we use to manage it is lifestyle modification. So if you are obese, you have to lose weight. Sometimes we do occupational therapy. So some people are prone to it because of their job, the way they sit, what they do. So we advise that you take them away or they reduce the amount of hours they do that kind of activities. Then for some people, we give them pain medications, which are analgesics, which I don't advise to stay on it for too long. There are various types of pain medication. So you can always adjust your pain medication with your lifestyle medication, which can actually help to relieve the pain, because the major problem of osteoarthritis is actually the pain and limitation in the movement of that joint. So physiotherapy also is another option that can help you achieve greater function with the affected joints. Okay,
so now for someone who is probably living with some kind of pain in their joints right now, and they're wondering, is it arthritis? What is it you look out for before you diagnose that, okay, this is arthritis?
Okay, so for like I said, we have various types of arthritis. So the good thing is that osteoarthritis can be easily differentiated from other arthritis. So for osteoarthritis, it's pain that will occur with activity. So the person has the pain now, and the person is involved in any kind of accident, and the pain increases. But other type of osteoarthritis, it doesn't occur that way. Other type of osteoarthritis, pain, activities actually reduces their pain. So when you have that, it's already suggested that, oh, you're having osteoarthritis. When you have pain with associated activities, then you have limitations in that joint. You can have stiffness.
Stiffness,
Yes, you can have stiffness, you can have deformity of that joint. So your normal alignment is now being bent. Sometimes some people at the back of their neck, you see them, they can't stand properly. So they have deformity of that joint. So those are the little pointers to osteoarthritis. While some people, you might not exactly get those symptoms as clear as that, an X-ray is usually the best to diagnose osteoarthritis in that kind of case. But not most times. It's not necessary most times. But if you can't really get it from the symptoms, then you go ahead to do an X-ray. Then it helps you with the diagnosis of osteoarthritis.
I appreciate that because, you know, there are some cases where people just go to the pharmacy. Oh, they're having pain here. I think is this. I think is that. Oh, I just carried this heavy load and the thing, you know, I started having pain. Don't worry. When I take painkillers, it'll be, you know, it'll take care of it. So this is reoccurring, right? It's not just one-offs.
No.
It's reoccurring pain.
It's recurring pain. Sometimes it's really a chronic pain that goes on for a very long time. You use the analgesic, the pain goes down. After a while, the pain comes back up. And like I said, it's worse with activities. When you're doing activities, it's worse. And I forgot to put in that the final line of treatment is after pain and everything, there's something we call intraarticular steroid injection.
Wow.
They can inject steroid at that joint that can relieve the pain. And lastly, if that doesn't work, there's a replacement therapy, which we do knee replacement therapy or hip replacement therapy.
I've heard about that, and I hear it's a bit of a procedure.
Yeah.
But all in all, it's not a death sentence. Thank you for saying that, and thank you so much for coming to talk to us about this. It is a big thing, and a lot of people are going through it. Please talk to us on social media. Use our hashtag WakeUpNigeria on TVC, and you know, ask a question if you like.